Hello, everyone. I hope you're all having a great day so far. My name is Lukman Siddiq, and it is my honor and pleasure to be your host for today. I'd like to welcome you all to today's webinar under the Career Guidance Series, US. For those of you who don't know what Alfaisal MedHub is, Alfaisal MedHub is an initiative under the umbrella of the International Office College of Medicine that aims at creating an online global community of medical students. Alfaisal MedHub covers a broad range of topics that are common to medical students all around the world. Our primary objective here at Alfaisal MedHub is to help medical students learn more about the career opportunities available after graduating, as well as the steps involved in pursuing them. Since medical students are always confused about the path that's ahead of them, Alfaisal MedHub's Career Guidance Series addresses this challenge from the perspective of accomplished and experienced seniors. As you're all aware, we are now conducting the Career Guidance Series US for all medical students, and this is in partnership with AMBOSS. We are excited to introduce you to Dr. Ravi, who will be delivering this webinar under the Career Guidance Series US, titled From the Lens of a Physical Medicine and Rehabilitation Residency Program Director. Dr. Ravi is an associate professor and the current program director of the Physical Medicine and Rehabilitation Residency Program at the Rush University Medical Center at Chicago, Illinois. He has served a variety of roles, including patient safety officer, medical director of inpatient rehabilitation services, and course director of rehabilitation grand rounds. His main clinical interest is in traumatic brain injury, Parkinson's disease, spinal cord injury rehabilitation, and movement disorders. He's also passionate about disability advocacy and served as president of the Young Professional Leadership Council for Access Living, which is a disability rights organization in Chicago. Thank you so much for joining us today, Dr. Ravi. We are looking forward to this exciting webinar. We'll start shortly, but before we do, I would just like to ask if you'll be taking the audience questions like as they come, or whether you'd like to save them for the end.
We can take them as they come. They can put them in the chat. That way, as I see them, I can stop and answer them.
Okay, Doctor, sure thing. So we'll begin with the first question, which is, okay.
You can literally do anything and everything that you're interested in. And so the main role is a physiatrist is to oversee the recovery of someone who has an injury. So if you think about it, you're going to go to the floors, you're going to see someone who has a stroke, and neurologist is going to come in and saying, you've got a stroke, you got to take the aspirin, the statin, et cetera, et cetera. You can now be discharged. But guess what? Life moves on. That person's going to say, I want to go back. I want to ride my bike. I want to drive a car. I want to go to work. I want to go to school. I want to be a husband. I want to be a mother. I want to be a father. Whatever that their life they want, it's going to move forward. And so what our job is to figure out a way for them to return to life and be as functional as possible. Now, that doesn't always look the same. You think about someone who had a stroke and maybe they've got a little bit of weakness on one side. It doesn't mean that they're going to be running that marathon, but can they walk to and from the store? And so things that we do is we think about what are the things that are changed from that neurologic perspective. It's going to be your bowel, your bladder, your thinking, your mood, your nutrition, your fluids, your everything has changed. And so we're going to see that person, ask them what things are problematic and create solutions. So for example, if someone has frequency of urination after a stroke and they're peeing every 2 hours, well, guess what? They're worried about soiling themselves. So if they're soiling themselves at nighttime, they're not sleeping. And in the morning, they're going to feel tired. They're feeling moody. They can't think straight. They're getting angry. Their interactions are bad. And so for us, we say, wait a second, this is all, our problem is all because of our bladders going every two hours. So we can do a bladder training program, fluid management program, even some medications, smooth that out. And then we're going to talk about, okay, if you have to go every 3 to 4 hours, how do we optimize your abilities physically? So are you going to wear a brace, use a cane? Are we going to get you into therapy and get you to be stronger? And we're going to strategize, hey, maybe you can't go to the mall every day, but maybe once or twice a week is possible for you. So we're going to create these realistic solutions and advocate for these people with disabilities to allow them to be as whole and functional as possible. And of course, I'm talking about the neuro rehab, meaning life after brain injury, life after stroke, life after spinal cord injury. There's whole other things. So there's geriatric rehab. So for their older population that want to be active and be their full self, we have sports medicine, pain medicine, spine medicine, neuromuscular medicine like Parkinson's disease. So all those things that pertain to that. And the key here is that we're going to be working with partners. And so we're going to have a partner with, let's say you're doing spine medicine, you're going to have a spine surgeon that does a surgery part, and then we're going to be doing all the part with injections and therapies and help them prevent surgery from happening. And then of course, sports medicine is you're on the field, you're treating them non-operatively, doing all the things that any sports medicine doc would do, except you're not doing surgery. So I could talk on and on, but I think I want to save, I know we've got some other great questions.
What makes us feel special that one would pursue it? In other words, what is life as a physiatrist?
Got it. What makes it special for me is the relationships. For me, the far majority of the relationships that I have with people are positive. And so the patients are coming to me after a stroke and they're saying, I want to get better. And every small little victory, they're happy. I feel like sometimes in medicine, as people get sick, there's this sense of sadness. I'm getting older and I'm getting sicker and I need this medication. For us, we're doing all the positive things. And so all my patients come back and it's not me, it's my therapist, it's their families. They're all doing all the hard work, but I have these nice positive relationships with people and it just makes me feel happy. And that's why I feel like my field is so special. The other thing is that I get to truly work on a team. There's not necessarily a hierarchy in physical medicine rehabilitation because, I have physical therapists, occupational therapists, speech therapists, nutritionists, psychologists, nursing, the list goes on, and we all work together as a group and equals. My therapist will come and say, hey, this person's got a bad knee, you need to inject it, not in an aggressive way, but hey, come on, help me out. And then vice versa. I'm like, hey, we got to get this person out of the hospital. How we work as a team. And it's a true even playing field, which I like. I like to be on a team. And so it's also helpful because I don't ever feel like I'm on an island because I always have people there to help me help a difficult situation get better. And then I like as a physiatrist, and this is what I would tell you is, people always wonder, what is your work-life balance like? And anything that you do, it's going to be your choice. So if you choose to have, want to see a lot of patients because you want to make a lot of money, if that's your interest, or you want to do clinical work and research work, your life will be busy. But a typical physiatrist would have like any other clinic. You'll come in, start clinic at 8 and you'll be out of there at 4, which is not bad. But of course, every specific person is going to be different. My work schedule is going to be a little bit longer since I do all these other different roles.
Thank you, Doctor. Why might some people steer away from this field? How would you convince them otherwise?
Oh, that's a good question. I think some people just might want the intensity of being active when things actually happen. What I mean by that is some people might say, well, I want to cure the stroke. I want to treat the stroke. And so that person comes in and they're weak on one side. They're going to say, well, I want to be able to diagnose it, give that TPA. Maybe I want to be a neurosurgeon or interventional neurologist or neurosurgeon and be able to go and pull that clot out, right? I want to be active. For us, we're more of a slower pace. We're going to see improvements over not 2 days, but 2 weeks, 2 months, 2 years. And so if you don't have the patience, then it may not be the field for you because some people will just say, well, I don't know how to help this person because, there's just too many things going on or there's not enough things to intervene upon. So it can be passive at certain regards. I would convince them because I would tell them as they get older, you want to not have all that stress because life is going to give you so much more stress than it needs to be. And I would say try to find a job and a work that is not as stressful. And it's very nice when we're able to say, all right, we're going to do this intervention and we'll see you in 2 to 3 months. And, and the patients understand, this is a slow process. So that's what I tell them. This is the life of seeing patients in a least stressful environment, which is great.
Thank you again, Doctor. The next question is, what is a physical medicine and rehabilitation program like at Rush University?
Got it. I have to say it's the best, right? Because I have to support my team. So I would tell you, physical medicine rehabilitation residencies are going to be similar because they're all governed by the ACGME, which is our governing body to make sure that we all have the minimum number of experiences, whether it be inpatient, outpatient, sports medicine, spine, all those things, right? And so what makes us unique is we place a lot of emphasis, at least from my mind, on health equity. So we do a lot of work with disability advocacy. We have residents that are involved with health equity, so looking at the disparities in the care that's provided for people based upon their race, their sexual orientation, their sex, whether male or female, or their economic status. We also do a lot of work in the community based upon that. We have a very rich QI program. We're working on our research program. And I think the main thing is, if you're looking at what is it like at Rush, is that everybody really gets along. We're a big family. I know a lot of programs will say that, and hopefully every program says that. Our residents get along really well. I was in the program as when I was a resident myself, and gosh, every day after work, we'd say, all right, where are we going? We're all going to hang out. We're going to have a great time. When we worked, we had a good time. So I think what I would say in our rehab department is that we're a family. We get along. We have a great time. Of course, we get our work done. We have a great program with disability and health equity, which I'm very, very, very proud of. And we have very robust, inpatient, outpatient programming, and we're growing. So hopefully that answers it. I don't know. I feel like all these questions I could talk for hours on, but we don't have that time.
That was indeed amazing, Doctor. That sounds like a program I'd want to be at.
Good.
Doctor, what is your general advice for IMGs looking to match in this field, and how can they be stronger applicants?
Right. I think the number one thing that I would say for IMGs is, one, don't ever look at the stats or the data. And the reason why is that stats and data, you can read that, interpret that in a very negative way or a positive way. You can look at stats and they look not positive, and you can say, oh man, I can't do this. You're going to defeat yourself by being negative. What you want to say is that if this is something you like, you got to go for it, because you have one life to live and you have to go for it. And if it doesn't work out, it doesn't work out. It doesn't matter, but you have to give it a good shot, okay? So for one, positivity, positive visualization. Think about all the ways that you're going to accomplish it. That's one. Number two, the main thing that I would do is that in this field, like any other field, relationships matter. Okay, so relationships meaning, nowadays it's easier, right? You can Google any different program and try to set up meetings with different programs or program directors to introduce yourself, but also bring in something. What I would say is that, you want to look on their website. If there's something that really piques your curiosity, you're like, oh my gosh, I saw that you do, let's say with us, disability advocacy. Well, I live overseas. Is there any way that I could get involved because I'm really interested? But don't just say that and then they're going to say, hey, why are you interested? Make sure you have a good backstory and make sure it's genuine. You don't want to just make it up, right? And so you want to have this in. So you're not just having a random meeting to talk about the program, but you're also saying how you want to get involved, okay? So think about the different programs that you feel are interesting to you, or in a location that makes sense, whether you're like, oh, there's a great community I have in New York or LA or Chicago, Florida, wherever. And that, and so you can also kind of tell them, oh, my cousin lives here, which is why I really like New York or Chicago, okay? And so you want to create those relationships with those programs. Number three, you can create those relationships with programs for people in general by joining the academy. So the AAPMR or the AAP, I'm going to put it into the chat. You can look it up, AAP, AAPMR. And so each of those are going to have medical student programs. So you can join those groups and you can meet other medical students, and you can also meet other attendings who are there for a reason because they like to mentor students. And so what they'll do through these relationships, you can join a board, you can join a subgroup, and they'll give you different opportunities to do some scholarly activities. They're going to say, well, we're going to do some advocacy work about creating more, pain awareness in the community, or we're going to put on a journal club. The list goes on. They do so many great things through both the AAP and the AAPMR. And so if you join that, you'll get to meet people and you really, once again, creating those relationships, okay? Number three, you really want to figure out a way where you can show your face at these programs. And so if you're able to do an audition elective, meaning you're able to come to the States and do an elective at any one of the programs, great. Some programs are going to be restricted, some programs are going to allow it. But at the very least, they might say, well, you can come for a week or two, we'll offer you credit, but you can certainly come and shadow for 1 to 2 weeks. Well, they can see how you do. You can, make sure you prepare and you're engaged on answer and say, oh my gosh, you are amazing. And really for us, no matter whether it's from the States or their ING or wherever, the fact that people show up and we're able to meet them means so much. Because what we're really looking for is people that we want to spend time with for 4 years. And especially for me, I don't want someone who's going to be a headache, So a lot of times we'll say, gosh, we look at someone on paper, they look okay, but then we meet them and they're like, oh my gosh, this person has so many great qualities that we want. They're a nice person, they speak to patients well, they're very smart, they work hard. And then the final piece is, how do you become a strong applicant? You want to look as strong as possible on your CV. So one, you want to do your best you can on boards. I know boards is going to be pass fail, so that won't matter. Try to figure out any way in your home city, in your home region, to get involved with sports medicine, so sports sideline coverage. If there's adaptive sports, get involved with that. You can join my PMR Medical Student Fellowship, which I know this group is involved with. So you can do some scholarly activities with case reports. You can do rehab and review. You can do rehab measures database. These are all just kind of activities that you can do. Do any and all activity that you can do that's rehab related. And that's going to just make you look good that you understand rehab in the way that we are looking for. But the number one thing that we always worry about is, does the person really understand the field? And doing all those things will help you understand the field.
Okay, thank you so much, Doctor. When evaluating applicants, what is the most important aspect of the application for you? And what are the most common red flags?
The most important aspect is, do they understand PMR? Have they done enough activities to really express understanding what PMR is, from spine medicine to sports medicine to neuro rehab, et cetera? The most common red flags are if someone doesn't have any PMR activities and they're like, they want to do it, we're going to wonder, well, how do you know you want to do this if you've never experienced it? And that's for us because we're not as well known as the field.
Okay, thank you so much, Doctor. What do you look for in an interviewee, and how can someone stand out during interviews? And on the other hand, what are some of the red flags you have seen in interviews?
Gosh, okay. When we look for someone, it's got to be as genuine of a conversation as possible. I know that's such a generic thing to say, but we're really looking for a connection of some sort. And so, a way you can stand out is, if you write down in your ARIS application about different hobbies that you like to do, and you're like, I like to golf, and I'm a golfer. I'm gonna say, hey, tell me about golf, and why do you like golf, and do you play? Well, you end up having this unique conversation about something that has nothing to do with PMR. So when people stand out, it's really funny when I have my colleagues come say, oh my gosh, we talked about movies, for the first 5 minutes. I really like this person. We all like the same movie, And so you're really trying to understand who they are as a person. And so that's the way that you stand out, by being yourself. So don't try to be someone or be so, I don't want to say you're always going to be professional, but being so robotic where you're trying to give this perfect answer and you're not showing emotion. It's perfectly fine for you to show enthusiasm and happiness. We want to see those emotions because we want to feel like we know you. The red flags that we've seen is people that, one, they're just you can see that they've rehearsed their answers 100 times and they're sticking with their rehearsed answer. I'm sure I can say about American politics, but the politicians that say the same darn thing every time you ask them the question. We want to make sure that it seems natural. And the other red flags is, if someone says, there's something, I don't see negative excuses, rather than saying, I feel like I didn't prepare as well as I should have, and I learned from that because I did X, Y, and Z. And if you look, the next time I went around with neurosurgery, I actually did much better, and I'm still learning a lot. But it's really showing, hey, I'm being honest. Someone that says, oh, my surgery attending just hates me and he hates all people, that's why I did poorly. We're going to say, well, that's a red flag. You don't seem to understand that, there could have been a component that you did poorly.
Yes, Doctor, that is indeed very. What are the do's and don'ts when it comes to personal statements and CVs?
Gosh, okay. So with personal statements, what I would say is, at least in PMR, the far majority of personal statements are going to be generic. And I don't mean that in a bad way. It's always going to be the same thing. I had an experience with rehab through a family member, and it inspired me. And then I went to my PMR activity, and I was really wanted to do it. Then I did my audition elective, and I loved PMR, and this is why I want to do PMR. That's kind of the stock kind of thing that people write, and that's fine. That's fine. The don'ts would be, don't go off into left field, meaning don't go off and talk about something that has nothing to do with PMR and there's not much of a point to it. I didn't even know how to explain it, saying, I love gardening, but you got to figure out a way how that gardening has something to do with PMR, and there might be a tie-in. Every once in a while, I think, the dues of being honest about your stories. I think if people can be touched by your story, that always goes a long way. I mean, some people will say, like for me, I'm touched by different things than some of my colleagues. If someone says, well, hey, I do a lot of disability advocacy. So if someone talks about something regarding disability advocacy, I'm going to say, oh my gosh, I love this. I love this person. This person really gets it, and I want to work with this person. So, just be honest about your story. Don't be dishonest, because that will come up during your audition elective. And there's no, the don'ts are, one is make sure if your bottom paragraph that you've written the right program. You want to make sure that you've written physical medicine rehabilitation, whatever program you're applying to, because some programs will ask you for a program-specific thing, a specific paragraph. But there's no don'ts. I would just say stick to your own heart in your story. Don't try to write what you think I want to see, but actually just write what's truly in your heart. And I wouldn't worry too much about the personal statement, because for the most part, it's going to be, I don't want to say generic, but it's not going to move most people. But one person out of the 10, it'll move,
Yes, doctor. How much weight do letters of recommendation hold, and what makes a strong LOR?
Well, this might be a little biased, but I think sometimes the letter writer means a lot. So if I see a letter writer of someone I know, like, for example, one of my colleagues, if I work with my colleague on a project and they write a letter of rec, you say, oh my gosh, they got a letter of rec from my buddy, that's strong to me because I really like them. Or if it's someone that's very well known in the field, that will be a strong letter. That content means so much, because some people write a simple paragraph, and that to me it says, oh, maybe they don't know that person. Versus someone that writes for a very long letter of recommendation with specific details. The best letter of recommendation that I saw was one of my colleagues from another institution wrote all these comments that residents had said about this person positively in terms of how well that they were working well in a group, And I was really moved by all those comments. I was like, gosh, this person's really good, So a strong letter is one that's going to be long, it's going to be personal, and hopefully from someone who's somebody in the field that knows people. Ideally, someone who's in a residency program, or even a program director, always goes a long way, because if I have a question about somebody, so let's say that you get a letter of recommendation from a program director I know, I'm going to call that program director and say, hey, how is this person? Is that person someone I should match in our program? So.
Okay, doctor, thank you so much. How important is research, and what do you look for in terms of an applicant's research experience?
Yeah, this is also a little biased. It's so interesting. Some programs will put an emphasis on research, but PMAR is not as research heavy as other fields, let's say. There are programs, that research a lot. And so my advice to you is that pursue research if it's something that's really meaningful to you. But sometimes research has to be done strategically. So if you did research at a big institution, let's say it's Shirley Ryan Mobility Lab, or it's at Kessler, which are two big institutions, you're going to create relationships that perhaps you're going to get a letter of recommendation that's going to allow you to go further in the field. But for me, the far majority, I would say you don't necessarily have to do research. I'd be more interested in knowing your extracurricular activities that are PMR related, whether it be sideline coverage, case reports, adaptive sports, disability advocacy, or PMR interest group, and doing a talk. All those things are important. Because the other thing too is that a lot of people will do research, but do you really understand what's going on? Because if you did a research, I'm going to ask you, hey, what did you do? And if you said, hey, they just forced me to write down numbers on a piece of paper, and that was my role, I'm going to say, okay, well, that's cool, but did you learn anything from it? How involved were you? And some people do research for a month and then they're done with it. So what is the meaning of that? So all in all, what I would tell you is that if it's truly something interesting for you, pursue the research. Because then when I ask you questions about it, it's going to be obvious that you're really truly engaged. We've had a couple of students that have come by that have done their own research projects, which has been great. And then we've had a lot more that have just been participants, which I'm like, okay, that's cool. But I really want to know, did you really learn more about our field? And that's the most key, like I talked about before, is understanding physical medicine rehabilitation.
So, Doctor, research is definitely favorable, but it is more valuable when it is more focused towards the field itself, right? And like when you took it for the value that it gave you, and not just for putting it on your CV.
Exactly, right? And so, if you did more PMR specific on things, that means a lot more than if you did research about, muscle fibers microscopically, bench research. It's hard to use that clinically. So clinical
Yeah.
research, if you're going to do something that's more clinical research.
Yes, thank you, Doctor. What are some questions applicants should avoid when they are given the chance to ask questions at the end of the interview?
The questions I would avoid are questions that are on the website or answers that are on the website. And don't ask open-ended questions saying, I would try to avoid the generic questions of, hey, are there going to be any changes in your program? Be more specific, just state, hey, I heard blah, 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 blah. Is, let's say you said, well, I was reading a lot about COVID-19 and the effects it has on the body. Do you anticipate that being a rotation where people with post-COVID symptoms are provided care and can residents get involved? Or, hey, cancer rehabilitation is getting more and more popular. I saw you have a cancer rehab doctor on your in your group. Do you anticipate you making changes to your rotation so people can spend more time with that person? See how it's more specific and you've read the website versus are there going to be any changes in the program? I generally get, I don't say not annoyed, but I'm generally kind of like, oh, you're just asking me generic questions for the sake of asking a question. So be specific, do your homework, do your research, and it's perfectly fine to ask a fun question saying, hey, I really like Chicago. What do you think is the best pizza? And I would probably just start laughing and saying, okay, my favorite is this, And so that really warms you up. So just be, I hope that answers that.
Yes, Doctor, definitely. What are your thoughts on post-interview communication, such as thank you emails?
It's so funny. And I feel like an old man, and I can say in my day, we had to write cards and mail them. So I think we get emails. I think it's perfectly fine. I think sending an email is always a positive thing. No one's going to ever be angry. I think it's nice to send a thank you email and then being specific about what you personally talked with that person and what you liked about the program. Of course, the person that receives it, it's hard. For me, every 2 weeks we're meeting new people, and I don't want to say, oh my gosh, I love you will come and my colleagues all like somebody else, and I don't want to mislead you. So you may not get communication back, or you might get just a generic response back. But yes, I would definitely send them.
Okay, Doctor. Do you have any advice for unmatched applicants to improve their odds for the?
If you're going into PMR, that's what I would talk about is you can certainly get involved with that fellowship program that I run. And the hope would be that, the likelihood is that you're unmatched, maybe for one specific reason. So you really need to identify what your weakness is and try to change it. If it is something related to step scores, well, maybe you can't change that except if you take step 2 or 3 and you're able to improve your score. If it's the lack of PMR experience, that part we can change by getting involved with the APMR. And like I mentioned before, creating those relationships. So what we really want to see is that if you didn't match year 1, year 2, you want to get involved with any and every activity, be strategic with who you're partnering with. So like I said, if you're going to do research, try to get research at a residency program saying like, I will do anything you want me to do research-wise, and I would like to help because those are, you want to be strategic so you can get not only research experience, but a relationship, maybe a letter of recommendation, an additional elective, all those kind of things. So you really want to build up as much PMR activity to prove to everybody that you're still dedicated to this field. And so that CV grows and gets bigger and more meaty, if that makes sense.
Yes, Doctor. Doctor, I think we have maybe one question left, but before that, there is one
Sure,
question that someone wanted me to ask. It's related to the research
sure.
question, but I'll ask it anyways. They said like this is a very interesting field, and thank you for your time. But the question is like a lot of our seniors state that having research projects in different fields may be a negative thing for applicants, as some program directors perceive this as an indicator of a lack of interest from the applicant. However, as medical students, we often take whatever comes our way. Could you kindly shed some light on whether this is true for PMR specifically and in general for all residency specialties?
Yeah, no, I don't think there's anything wrong with you doing research in a field. One, you had to take what you got because that's a requirement, or you were just interested and you want to continue with it. It's a matter of how you talk about it, right? So let's say that you did some dermatology research for a couple of years, but your application still has um, a lot of PMR related activities, and we're on the interview and I'm like, gosh, you've been doing this dermatology project for 3 years. How come you're interested in PMR? You're still doing this? I've heard answers like this, which I've been impressed. You know what? I thought I liked dermatology, but I fell in love with PMR, but I'm a person who honors their commitments. So I told the doctor that I would continue this project until it was done. That is, that is very honorable. And I'll eat that up, meaning I will love to hear that. So there's always a story, or you're going to say, well, my school requires a research elective, a research project, and I got started in this project. There's nothing PMR related, so I had to finish this requirement. And that's it. I'm not going to be like, oh my gosh, why would you do that? We all understand that you're going to be pursuing different things. I wouldn't worry too much about the other things that you're doing. I just make sure that whatever is PMR related, you're doing enough of that, right? If that makes sense. So all the other things that you do is fine. I've seen some people that are in plastic surgery interest group, they've done some health equity work, and then they've done let's say dermatology, the list goes on, and then all of a sudden it's PMR, 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 PMR. I'm like, okay, I know that you like PMR.
Yes, Doctor. I think this is the last question, and basically,
Sure.
any last thoughts or words of advice for our audience?
Yeah, I would say the main thing that I would say is just stay as positive as possible and positively visualize how you're going to achieve your goals. Don't listen to anyone who's negative. If you have an idea of something you want to do, you have to go for it. I wouldn't compromise on it, because it's your life and it's your success. And I would never want to discourage someone from pursuing my field or any field. And then number two, as you are staying positive and you're pursuing that goal, regardless of what the odds are, whatever that is, be strategic. So if you're going into PMR, like I mentioned, if you're going to go do an activity, make sure you go and do an activity with somebody who could write you a letter of recommendation. You're going to come to New York, partner with some of the New York programs, get involved with their activities. Don't just do it by yourself, is what I mean, right? So like I mentioned with that Kessler program, I said they do a lot of research. If you do research there, you get most bang for your buck. You're getting the LOR, the relationship, the research, the connections, all those kind of things. So I would just say, pursue your dream. I really believe in all of you. And, even last year, 2 years ago, one of the students that came through our fellowship program, she matched at Harvard. And I'm so proud of her. And she worked her tail off. She was amazing. It was all her hard work, and she's the one that succeeded. And she was from Qatar and a medical school there. But she got into the best program, in the country. I have students that I know that wouldn't be able to match there, right? So anything is possible. You just have to believe in yourself and work hard, and those positive things will come to you.
Thank you so much, Doctor, for your time and for your words. Thank you to everyone in the audience for joining us. Again, thank you for the informative presentation, Dr. Ravi. I'm sure everyone in the audience has benefited from it. I know I have. We truly value your experience and guidance. I'd also like to thank AMBOSS for their constant support. To everyone in the audience, again, thank you for joining us today. We hope to see you again in the future. If you have any more questions, do feel free to leave them in the chat right now, or you can unmute yourself and ask your questions. Also, do make sure to follow us on Instagram and Twitter. And for recordings, etc., of our webinars, do make sure to subscribe to our YouTube channel. Again, thank you, Dr. Ravi, and thank you everyone in the audience. We hope to see you soon in the future. Have a wonderful day.
Thank you.